How does magical thinking affect contamination OCD? Imagine believing that your thoughts or actions have the power to control whether you get sick or not. That's what magical thinking is in contamination obsessive-compulsive disorder. It's a way the mind tries to make sense of uncontrollable fears about germs, dirt, or illness. When someone has contamination OCD, they often experience persistent, intrusive worries that touching something dirty or not cleaning enough will lead to harm. These fears can become overwhelming and lead to compulsive behaviors like excessive washing, cleaning, or avoiding certain places or objects. Magical thinking makes these fears even stronger. It leads a person to believe that specific rituals or phrases can prevent contamination, even though there's no real scientific link. For example, someone might think that washing their hands a certain number of times or repeating a phrase will stop germs from spreading. They might also believe that, if they don't perform these rituals perfectly, they or their loved ones will become seriously ill. This creates a cycle where performing compulsions temporarily reduces anxiety, but the underlying fear remains. The person feels they must keep doing these rituals to stay safe, which reinforces the compulsive behavior. This type of thinking makes the fears seem more real and urgent. It's as if the person believes their thoughts or actions have a magical power to influence real-world outcomes. For instance, touching a doorknob without washing immediately might be seen as causing illness, or skipping a cleaning ritual might be thought to lead to contamination spreading. These beliefs are irrational but feel very convincing to someone with contamination OCD. As a result, the severity and persistence of their fears grow, making it harder to break free from the cycle. Magical thinking also affects how people see their own condition. Some individuals recognize that their beliefs are irrational but still feel powerless to stop their compulsions. Others might have less insight and truly believe that their rituals are necessary to prevent harm. This can make treatment more challenging but not impossible. Cognitive behavioral therapy, especially exposure and response prevention, can help individuals challenge and change these magical beliefs. It works by gradually exposing them to their fears without performing compulsions, helping them see that their fears are exaggerated and that they don't need to rely on magical rituals to stay safe. In summary, magical thinking in contamination OCD links irrational beliefs to fears of contamination. It drives compulsive behaviors like repeated washing or avoidance, which temporarily reduce anxiety but also reinforce the false sense of control. This thinking pattern increases feelings of guilt, responsibility, and distress, making the disorder more persistent. Understanding how magical thinking influences contamination OCD is vital for effective treatment. It helps individuals learn to question these false beliefs and develop healthier ways to cope. Always consult a mental health professional for personalized support and guidance.